Hi, my name is Cameron Lister. I have a Master's in Public Health, and I am the creator of the LAF Model Framework. The LAF Model Framework involves using social media and new technologies in more innovative and cost-effective ways in order to create behavior change in populations online. Myself, as well as some other of my co-founders, we saw a couple of disturbing trends in the field of public health. One was a lack of funding and an increase of programmatic cuts throughout state, federal, and local levels in public health. And the other one was an inability or seemingly unwillingness to adopt new technologies and new innovations into our promotions and our programs. We saw those trends and we thought, well, I wondered if we could do something about this. So we set out to kind of prove an unknown, whether or not you can actually promote health without a budget and without really any means other than your willingness to participate online. So we started out with $0 and just an idea. We started by entering a couple of competitions. We got some people together, some different students from advertising, marketing, and creative writing. And we actually won some of the competitions, and that gave us some funding to kind of get things going. So we started up a website, and we thought, well, I wonder if we could actually go out and work with the health department. We went out, we presented it to different people, and we said, this is what we want to do. We want to be able to organize communities online. So we worked with different programs in Utah. The LAF model paper talks about one of those projects, Utah Family Meals. They asked us, with a budget of $2,000, to see if we could actually build a presence online that was engaging for people and that actually got people to start talking about, sharing, and discussing things online in relation to having family dinner together. And we were able to design a website, and by the end of the Family Meal Month, we actually ended the month with 1,500 Facebook likes and close to 260 followers on Twitter. The difference between what we're doing and what other people were doing is the fact that we didn't set out to educate, we set out to entertain. And that's kind of the core construct of the LAF model. That's why we call it the LAF model framework. We, instead of assuming that people didn't have family dinner just because they didn't know that it was good for them, we assumed that they didn't have family dinner because there was some barrier to that behavior. We provided recipes, that were healthy, ways to work around schedules, ways to eat family dinner on a budget, helping people solve the problems that they were facing in their daily lives without assuming ignorance. And so that's what we want to do. We want to take public health to the next level. We want to make public health viral. We want to make it something that people want to talk about and discuss. We don't want to be the quiet hand of good. And that comes through better marketing, better branding, and better messaging. And that's what we're seeking to do. And doing that through social media is the most cost-effective way to do that. There's so much competition out there, absolutely incredible amounts of competition for people's time and people's energies, that we can't afford to be that quiet hand anymore. We can't afford to just be an educational voice in the dark, but we have to be something that's loud and obnoxious.
Stop throwing things at people!
And something that's engaging to our target audience, or else they'll quite frankly continue to ignore us. You can in fact collaborate through social media more effectively and more efficiently, and you can do it for less money. Your promotional messages don't have to be generic. They don't have to be necessarily educational. They can be empowering. They can be humorous. We can start to change the landscape of public health, and especially in regards to health promotion. We hope that you will participate. Please go to lafmodel.com. Hopefully together we can create a network of professionals who are set on changing the public health landscape and ultimately health for the future. Thank you. And that's the LAF model framework. Should have had someone with a horse head mask just running around the entire time. I should have been dancing. This should have been a choreography. We're gonna get this take. We are gonna get this take. Of the educational components. That's a word. The Why can't I talk now? Like after all that time, I did so well.